Good evening. My name is Tori Johnson, and my speech will concentrate on the impact of systematic racism on Black health outcomes. Although there are many historical events that influence the way that African Americans are treated in today's society, I would like to focus on the historical context of two primary experiments that were carried out on both African American men and women. Racism has served as a catalyst for many adverse health outcomes, and unfortunately, that has engraved a severe distrust with health organizations for African Americans today. To combat this problem, it is essential that those in healthcare are encouraged to learn the history so that African Americans may gain trust in these healthcare facilities and that the individuals treating them do so more responsibly. Researchers of the NIH National Library of Medicine have linked African Americans' mistrust of healthcare organizations to incidents of medical malice, which can be traced from southern slave plantations to a more modern-day healthcare environment. From gruesome experiments on enslaved people to forced sterilizations of Black women in the infamous Tuskegee syphilis experiment, it's no surprise decades of racism and discrimination have isolated communities of color, which have made them more susceptible to the COVID-19 virus. The Tuskegee experiment began in 1932 with approximately 600 colored men who were asked by the U.S. Public Health to participate in the study for so-called bad blood. The intent of the study originally was to record the time and history of syphilis in a Negro male. 399 of these men obtained syphilis while the remaining did not. In addition, the majority of these men were poor and illiterate sharecroppers. This allowed ignorance to the fact that they were being mistreated. They were enticed and enrolled into this study with incentives that included medical examinations, meals on examination day, and transportation to and from the clinic. At this time of the experiment, there were no proven treatments for syphilis. Soon after, penicillin became the standard treatment for the disease in 1947. However, since Black men were not seen as equal as white men, medicine was withheld from the control and experimental group. Due to the number of men dying and families being affected by this disease, it set in motion to an international public outcry and a series of actions initiated by the U.S. federal agencies. These men were never informed about consent. Researchers also failed to inform the men of the actual name of the study, its purpose, and the potential consequences of treatment or lack thereof. Once penicillin became available, they were not allowed to voice whether they wanted to continue the experiment or not. Later, the study was unethically justified in October of 1972, shortly after the experiment ended. This evidently is only one of the many historical events that displayed the mistreatment of African Americans. One of the most important and consistent factors of racism in the U.S. was the efforts of whites to control the reproductive rights for people of color. For generations, African American women have continuously had their reproductive rights violated. Much of this violence has stemmed from the belief in white supremacy. White Americans believe that eugenics would be the answer to a preservation of the American way of life. Scaringly, this ideology was embraced by many scientists, social activists, and politicians, as a progressive social movement aimed at ridding society of undesirable characteristics. The ability to sterilize others was granted by the Supreme Court in 1927, with the Buck v. Bell case, which confirmed the constitutionality of Virginia's statute on sterilization. This is a clear perpetuation of the notion that the lives of people of color are less important than the lives of the Anglo-Saxon population. Many studies indicate high reports of medical mistrust among people of color. The Commonwealth Fund elaborates on the fact that only 42% of African Americans were willing to receive the COVID-19 vaccination, even though they are at higher risk to contract the disease. Researchers have also found that medical mistrust also stems from people's contemporary experiences of discrimination in healthcare, from inequities in access to health insurance, healthcare facilities, and treatments to institutional practices that make it more difficult for African Americans to obtain care. The PNAS journal revealed that half of medical students and/or residents held at least one or more false beliefs about the supposed biological differences between African American and whites. One example of that belief is that African Americans have a higher pain tolerance than white Americans. This study further displays the gap between medical students and residents and how to treat patients, how to treat African American patients. In addition to medical mistrust, people who say they mistrust healthcare organizations are less likely to take medical advice, keep follow-up appointments, or fill prescriptions, and are much more likely to report being in poor health. To close, eliminating health disparities between African Americans and whites will require the United States to focus on improving the social environment of African Americans. Correcting disparities caused by the social determinants of health, including racism, has no simple solution. Strengthening relationships between patients and the healthcare providers may be a means of building trust, as some studies found that African Americans rely more on the physician rather than the healthcare facility. It requires fundamental changes in policy at the local, state, and federal level, while also requiring public and private institutions to change many of their operating procedures.